Hi, my name is Simone, and I am a pelvic floor occupational therapist. And I am here today to talk to you about menstrual cups. So, menstrual cups have made a big resurgence in the past few years as a alternate way for those who menstruate to have periods without the use of pads or tampons. And there are many different styles, brands, varieties, but today I'm going to show you three different ones that are pretty common. There are many benefits to using a menstrual cup. They're, they are a little bit safer than tampons because they can be inserted for longer periods of time, up to 12 hours. Usually they are made from a medical silicone, so they are have less likely chance of holding bacteria. They are reusable, so they have less waste for the environment. They can hold more liquid or more volume. They're also very convenient for nighttime wear. Most people who menstruate are used to that feeling of sleeping like a board, but you have more freedom of movement when you use a menstrual cup. There are usually two different sizes depending on if you are a younger woman or younger person or an older person or have had two or more vaginal births. And so the only size difference is the cup may be a little bit bigger or a little bit wider. So the first I would like to show you is actually called a menstrual disc. These are disposable, um, but they are very nifty because they are more flexible. So as you see, it's a rubber ring that is able to bend and squeeze, and then a shallow bowl of plastic that allows the menstrual to be caught. These are very beneficial because you usually can have these on the go. When you're done with them, you can dispose of them. They also are able to be used during intercourse or intimacy, penetrative intimacy, without your partner feeling it or without causing blood. Um, and so the way these are inserted, a little different. This is my pocket test vagina canal. And so the way you would insert it would be to squeeze it, insert it deep into the canal. And the way the discs are made, they are made to hook right up under the cervix. So they are deeper into the canal. And then to remove, you simply insert your finger, you hook it gently around the edge, and you pull it out. And most times there is very little spillage, and you can just dispose of it into the commode and dispose of it into the trash. So the second type of menstrual cup that I would like to show you is a traditional cup, and it looks like this. So this is a newer age one. It has a little pull ring to help you remove it. Most come with a bag or a carrying pouch for you to have them. And usually with a menstrual cup, you are wearing it up to 12 hours. When you remove it, you simply wash it with soap and water and you reinsert it until the end of your cycle. At the end of your cycle, you can boil and sterilize it and put it away until it is needed again. So these are a little bit more rigid than the disc. This is a size 1, so this is a size for a person that is under 30 or who has never had a vaginal birth. And so you simply, to insert, you fold it in half, and then as tight as you can get it, you would simply insert into the vaginal canal. It opens up and it holds. So if it's inserted correctly, you're not going to feel it. And there's even has been reports of it lessening cramping or the symptoms of cramping because it's given that internal pressure against the wall. And then to remove, you can simply insert a finger and you press in just a little bit to break the seal. And then you simply pull it down, keeping it upright You dispose of it into the commode, rinse, and reuse. I will say that if you have an IUD, you may need to ask your physician if it is okay to use, simply because it may pull or dislodge the string. Um, but other benefits are, again, longer wear, less mess, less waste. You're able to know your body a little bit more intimately. And there are some people who are not open to touching their own bodily fluids. And my suggestion to you is to wear a glove. The third type of menstrual cup I would like to show you is, so this is a travel menstrual cup. It is collapsible, so you can collapse it down into a very neat package for it to be stored away or taken with you. And then when it is needed, you just pop it out and it's there. So all cups are usually made the same. They're made out of that medical silicone. They will have tiny holes around the rim to help with suction and to help with seal. This one functions the exact same way as a traditional menstrual cup. You're simply going to fold it, and these are best inserted with either a little bit of lube around the edge, um, in the shower, or in a complete sit on the commode. But you're going to insert, you're going to let it open up, and it's going to stay there until you're ready to remove it. And again, you're just going to gently insert a finger after washing your hands, and you're going to push in just a little bit to break the seal, and then slide it out, keeping it upright so you do not spill it, and then you dispose of it in the commode. These three options are a great alternative if you are looking for something other than pads or tampons to support you during your monthly cycle. If you have any more questions or concerns, please leave us a comment below. Thank you.